aspects. One aspect would be the history, right? The history of failures, let's say. So this is important to understand from the sending unit, the originator. I mean, what kind of history they had regarding this specific aspect we are seeing. But not only the history, but also the type of technology that we are going to use. Some technologies are more limited than others. Some are could be not top of the line technology, and that technology used in the manufacturing could have an impact in terms of occurrence. So it has like two different views. Of course, you already know we need to evaluate, so this is important in terms of how we assign a category, right? And this is important to avoid being biased and to have the right people in the team. So my recommendation is before you start any risk assessment, tech transfer or any, it is important how you are trained in the tool and how it is moderated and how the team is conformed and how the data is managed. You know that sometimes data can be misleading, so it's important to understand what you are going to consider, because the risk evaluation is something that needs to be, it's a critical step and needs to be, it needs to have a rationale behind it. It's not only putting low, medium, or high. You need to explain, and you need briefly the rationale behind the medium, low, medium, or high. And of course, because this comes to the decision, critical decision, if you need mitigation or not. And then you introduce the possible control measures. Of course, then we need to monitor this. This means that we always going to have residual risk, as we mentioned, session 1. Here, they separated residual severity, residual occurrence, residual risk. This is another way to show it. No problem, you could have one residual risk. And if you need any further mitigation or further control measures. So actually, when you perform this exercise, you would have it, in theory, you would propose a measure, mitigation measure, to bring down from high risk to a medium risk a certain aspect. However, then you need to implement the measure eventually, and then you need to verify the efficacy of that measure. So that part, that last part of to verify this is sometimes something that is overlooked by the organizations, and is something that is included in the ICHQ9. As you can see, the last step is to verify, right, and to revisit regularly your risk evaluation and your risk analysis process. Okay, so some typical pitfalls in terms of tech transfer would be, of course, protocols not revised or approved by manufacturing, engineering, process owner. So this, again, is also related to data integrity, right? So data integrity in the most broad sense, a protocol that is not revised or poorly revised is a data integrity issue. This is important to understand, because data integrity is not only the typical good documentation practices, meaning how to amend something. That is, of course, a minimum requirement. But data integrity, the modern concept, goes beyond, right? And it includes, as we mentioned, the quality of the documents, in this case, protocols, and how they're revised. It's not enough to have 3, 5, 7 approval signatures in the document, which is something very common. The important thing is to understand which is the impact, or what should each approver or reviewer do in terms of the document. So this is a typical one that is part of the tech transfer problems. Of course, we could have test failures, maybe qualification studies not documented, again, data integrity issues. Key personnel not adequately selected or qualified to organize and execute the tech transfer. Okay, this is very critical in tech transfer. And that's why the first part by Dr. Dong gave exactly the picture, because one aspect is how is the key personnel or the trained personnel available, for example, in a country which is the receiving unit, right? So between a country that has a lot of skillful personnel available in the country because of certain factors, then when you want to transfer to the receiving country, the receiving country has problems because there's not enough technical personnel available for different reasons. Or maybe the pharmaceutical industry is not very well developed. So obviously you're going to have less personnel. So this is important to understand this even from the start, even in the stages of the tech transfer agreements, to understand this problem and to decide how to cope with the problem. Poor project management by not appointing the required qualified people. That also is another thing, because we might have the people, but of course we might not be able to decide in the right way how to dedicate these people to the different tasks. So this means, this point 3 and point 4 means that human resources, not only in the availability of people, but also in terms of how to select them, and of course based on job descriptions, which should be very well designed, is very important. So this is important also when, in the case when you have a tech transfer and the receiving unit is new. I mean, they haven't produced any product so far. So the first activity they perform and they start producing is based on a tech transfer. So this means that the company does not have history and experience. So this would be like the worst case in a way, right? Because the company has a lot of things to do and to develop the quality management system, to pick up the people and everything, and that is a huge impact into the tech transfer. If you don't understand that, your tech transfer will start in the wrong path, and you will underestimate this, and this would become a problem. Of course, absence or poor gap analysis or risk assessment, right? Of course, I would also add, or a late, right, gap analysis or risk assessment, because some companies, as they have the problem with planning, as we mentioned, then they realize, or they're able to perform a risk assessment, but after a lot of things have been decided, including equipment, including a lot of process definitions. So in that case, if you perform a late gap analysis, it's of little use. Okay, now we'll touch a little bit about analytical method transfer. Of course, we have this aspect, which is also mentioned in the WHO TRS on tech transfer. It has to go hand in hand with the manufacturing tech transfer. So in order to give some definitions, we say that the transfer procedure, of course, talking about analytical methods, is a documented process to qualify the receiving lab to use an analytical method originated in the sending unit lab, right? This procedure assures that the receiving unit has the required knowledge of the analytical method, which was transferred, and the capacity to perform it. So these two are important. You can have the required knowledge, but maybe you have problems to perform it. So knowledge and capacity, both things I would like to highlight. And this is coming from the USP. Okay, it is a process expected by regulators to verify the reliability of the assay under field conditions. So this is the expectation, right, in terms of the receiving unit. Of course, it reduces failure rate. That is one of the main objectives of this analytical method transfer. This is also coming from the TRS. You can see the analytical method transfer protocol. So we need to have this protocol that we mentioned for the manufacturing with acceptance criteria, documentations, deviations. Very important to understand this and to describe them in any reference. Sending unit should provide the method-specific training for analysts and assist in all related aspects. I would say that this second bullet regarding the training is one of the key aspects of the analytical transfer, as it was probably for the manufacturing part. So this communication and this planning of the training between the sending unit and all the resources involved are critical. The receiving unit reviews the analytical methods provided and agree on the acceptance criteria, so they should be in agreement. Of course, as prerequisites, we need the quality control equipment qualified, the variability and sensitivity of methods and specifications understood. The WHO TRS includes a table with experimental designs and acceptance criteria for analytical testing that we encourage you to also visit. Okay, for analytical method transfer, we have different approaches. And as we will see, usually this first one, which is comparative assay approach, is the most widely used. Basically, what we are going to do is to test a representative number of samples for both sending unit and receiving unit using a method previously validated by the sending unit. So this is important to highlight, previously validated by the sending unit. So this approach, number one, which is the most common one, requires full validation by the sending unit. There's other approaches like co-validation, meaning the original validation studies performed by the sending unit and the receiving unit in parallel, usually for incomplete validated methods, not commonly used. This co-validation approach. And also we have revalidation. The receiving unit repeats certain parameters of the analytical method known to be affected by the transfer. Right, so this is important because this is part of the knowledge of the method. So the sending unit, they know which parameters are more difficult and may be more affected by the method conditions and transfer. So that knowledge needs to be understood. Of course, the sending unit again is responsible to validate the method. The receiving unit receives the validated method and may revalidate it completely, which is rare and costly, or partially, considering the most critical characteristics of the method. For example, precision, linearity, accuracy, limit of detection, limit of quantification, and specificity. Also, this is based on the gap analysis that also needs to be performed. Again, the second bullet highlights to identify the most critical characteristics of the method. This is also telling you that